Hey,
Hey, how's it going?
good. How are
Um,
you?
yeah, not bad. Just just getting it. I was just telling the guys that we want to know if they've had any issues with their backs or necks and other body parts that have been painful due to work, and to drop those in the questions if they haven't already. How's it looking over there?
Pretty good, pretty good. How about you
Awesome.
guys?
Yeah, it's really nice today. It's really warm.
Yeah, yeah,
We just found
yeah.
out we're supposed to be going back to work, so everyone's trying to work out what's going on.
That's
So it's a
amazing.
bit
Congratulations.
hectic. Yeah, we're all a bit 50-50 because we don't know whether it's safe, so we need to find out and work out how we can do it. Um,
Yeah.
but we'll get there, I'm sure. Got loads of people joining us, which is awesome. Um, what's the kind of how many people do you see with who are dentists? Uh, and then kind of what issues do they always come in with?
Yeah. So I haven't met a single dentist who hasn't had any issues. And
Mm,
typically it's neck pain, back pain, and a little bit of wrist or forearm stuff. So, you guys face a very unique set of challenges. It's always really interesting to me, how, your setup can really affect the way that your body works. And so it's just started, the more I started to see it, the more I developed as a special interest. And I did a lot of research, and learning in this department so that I could help you guys better.
yeah,
And so yeah, those would be the top things that I see.
yeah. So what's the kind of process becoming a chiropractor? It's not something that we really know much about.
Hmm.
Being dentists, that's kind of we get lost in our own world. So what's your journey kind of been like?
The process of going to a chiropractor?
Yeah, or becoming one as well.
Oh, okay. We'll start with becoming one. So, throughout the world, it's really quite different depending on where you are. But I can speak to how it works in Canada. And from what I understand, it's quite similar across the board. So in Canada, it's minimum of 7 years of university education. So you're doing at least 3 years of an undergraduate degree, and then chiropractic school is a 4-year postgraduate program. So that's the general, the process. And so during those 4 years, so it's very similar to dentistry in the sense that, you're learning basic sciences, clinical sciences, and then there's a practical part to that education as well. So
Mm,
for us, it's the last 12 months, we're in clinic and we're working under a licensed clinician, providing care for patients. And then there's our board exams and all that stuff.
and then
So
yeah,
yeah, so all that prepares us to be primary contact healthcare professionals, which means that patients can walk into our door without needing a note from a family physician.
mm,
And so any patient that walks through the door, the process is pretty much the same. There's always a consultation process, so we're taking a very thorough medical history. And then from there, we're just like screening, making sure that patient is appropriate for chiropractic care and they're in the right place and getting the right care at the right time.
yeah,
And then there's a physical exam that happens then as well. So, the patient journey kind of follows that same process. And then before any treatment is started, there's always the process of informed consent. So explaining to the patient the diagnosis, what the plan is to take care of it, how long, things should take before they start to see results, and then getting started from there.
yeah. Cool. So if one of us were to come and see you, um, what are the first things that you're kind of asking dentists specifically about their setup at work, habits outside of work and the level of exercise and things like that? What are the factors that are involved?
So first and foremost, we want to make sure that in order to, I guess, provide the best care, we want to make sure we're taking away some of those exacerbating factors. So how's the setup at work? That would be one of the first things I want to ask. What kind of a stool are you sitting on? Are you using loops? Are you not using loops? Those would be, some of the starting places I would go. What are they experiencing? Because everyone has different issues depending on their body type. So some people have really bad low back pain versus others,
Yeah,
their main complaint is neck and upper back or shoulders. So that would kind of, I guess, narrow down my focus. And then, yeah, so there were a couple questions you asked. What else was?
Yes, the main factors that you see which are affecting the dentist, and then the other
Yeah.
question was how does level of exercise and
Mm.
social habits kind of affect it as well?
Okay. So what it all comes down to is the fact that dentistry involves a lot of sustained awkward postures, and so the slouching in the low back or the leaning forward of the neck or the hunching forward of the shoulders, those are all things that I would want to work on to correct. And
Mm.
then when it comes to exercise, the fitter you are, the better. But you definitely want to be very intentional with your exercises. So I think yoga is fantastic for dentists, especially because there's the component of the flexibility, which is really important, as well as relaxation. So we know that there's a huge link between our mental health and our relaxation and our muscle and joint health. So that is always a great idea. You want to be careful about certain things. If there's something, any exercise that you do that feels like it's exacerbating your pain, you probably don't want to do it. And you'd want to seek, professional advice and see how to modify it, or, what specifically you want to be doing. And when it comes to, targeted strengthening of muscles, my best recommendation for dentists is you want to train for it's like if you consider dentistry to be an athletic event, you want to train for it that way. So for the practice of dentistry, you're doing sustained, repetitive movements. So you want to focus on endurance
Yeah.
exercise. So that's low weights, but a higher number of reps with little rest in between, so that you're preparing your body for that physical activity.
Mm. So what kind of exercise are we talking? Kind of like a lot of cardio, or from my kind of thoughts would be you need that core strength.
Yes,
So how
absolutely.
would you, because if you're doing a lot of cardio, you don't really build any core strength.
Mhm.
Um, so what kind of a regime do you kind of see working really nicely?
Yeah, so I mean, cardio is great for just general health, but specific to dentistry, I would recommend, there's a couple of favorite exercises that I recommend, and I go over it a little bit in one of my IGTV videos.
Mm.
So for core strength, you want to focus on strengthening the transversus abdominis muscle. So this muscle is like the back belt of your spine. It does a
Yeah.
lot to support your low back. So planks are great, side planks as well for strengthening the obliques. I also really like the bird dog exercise. That's the one when you're on all fours and you raise one arm and the opposite leg. And so you can just Google that and you can see what that looks like. So that's great for providing, again, more strength and stability for the low back. When it comes to the neck and upper back, what you want to focus on is strengthening your deep neck flexors, because
Yeah.
these are going to help with keeping your neck in that neutral position, because these are the muscles that keep you, I guess, keeping from your head going from, they get lazy
Move forward.
basically when you're doing like this. So a chin tuck is a really simple way to activate that muscle. It's just a really subtle movement. It's nothing crazy.
Yeah.
And I also really like strengthening the lower trapezius muscles for just helping bringing your shoulder blades back and down, because when we're stressed or we're busy in the operatory, this is what happens, right?
Mm.
So for that, you can do a prone Y, so laying down on your stomach and bringing your arms up and basically squeezing that bottom part of your trapezius muscle. I also really love if you tie a resistance band to like the top of like a door frame or something, and just kind of doing a nice pull down like that. That's also a really great way to get that muscle working.
Yeah, a lot of these things, obviously, you could do a kind of more weighted exercises within the gym, but obviously that's quite difficult at the moment because we're stuck at home. So a lot of these things that you're describing are things that you can kind of do if you have a little space in the house somewhere, or in a garden if it's nice weather. So,
Mhm.
um, I think there's something. These are ones that everybody can do, no matter their kind of level of fitness. Um, whether or not you can do 100 reps or 10 reps, I think that's going to be like, it's going to
Yeah,
be beneficial for whatever level you're at, because you need to start from somewhere and build up
for
from somewhere.
sure. Yeah, exactly. And you need to build up slowly. You don't want to be throwing all these new things at your body at once, because then you're
Mm.
going to likely injure yourself, which we obviously don't want.
So if someone actually comes to see you, what are the things that what's your routine? So I've just walked in the door, for example. What's your um, consultation kind of structure? How does
Well,
that go?
my assessment starts from the moment I see the patient. So, how are they sitting in their chair? What is their sitting posture like? What are their,
Mm,
those are kind of things that just like an observation we're looking at. And then I generally want to know, are they on any medications? Is there a history of injury? How long has their issue been going on? Is this a chronic thing? Is it acute? Is it something that's more of like a repetitive strain nature? So is it one of those things that, started off as like nothing, like maybe a little bit of a loss of flexibility, and then started to become more and more of an issue over time? And then from there, just taking a very detailed focused history. Then I usually do, a posture assessment, posture screen. So we want to see, where are some of those issues. So in our clinic, we actually use some technology to help with that, and
right.
we generate like a basically like a handout for the patient. They can see exactly what their posture looks like versus what it's supposed to look like. Um, and then, then we're doing some orthopedic or neurological testing, narrowing down diagnosis, identifying exactly what structures are implicated in this pain problem. And then that's typically the first visit. Usually the patient will leave with some advice. So whether
Yeah.
I think that they need to ice for a little bit, because perhaps there's a lot of inflammation, or if there's something that they can do at home starting from like that same day that will help with managing their pain. And then I give them that advice, and then they come back at a later time. I go over all the findings with them, and I explain and I walk them through exactly what to expect with their treatment.
Mm. So what are the most common kind of areas that you see that actually a dentist could improve upon within the surgery, or what's the most common that's what you're doing wrong sort of thing, or most common like issue? You know what I mean? Kind of
Yeah.
the most nine times out of 10, the dentist has this issue, and that's going to make a big difference.
Yeah, so I would start with just like the setup in the office. So making sure that the chair is set up properly. So there's this misconception that your hips should be at like a 90-degree angle, with like your like so that so your hips are 90 degrees and then your knees are 90 degrees.
Mm,
So we now know that to be not the best scenario for your low back because of just how much stress that puts on your low back, and also you're more likely to slouch in that position. So the first thing I would say is, lifting a stool a little bit. If you're dealing with a flat stool, and you're able to tilt it just a little bit, that would be great, so that you have a wider angle at your hips and you're more of in a supported standing position as opposed to otherwise. A saddle stool is also fantastic.
yeah.
I really like stools with a backrest. I just find that it really provides a lot of good support for the lumbar spine. Um, and then, the setting up the patient. So you want to be as close as you can to the patient so that you're not as inclined to lean forward. When you're working on, the occlusal plane of the upper arch, you want to make sure that you're tilting you're reclining the patient enough so that, you can work on that area without bending your head
Pushing
forward.
forward. Yeah.
Yeah. So there's a couple strategies around that, that I would work through. And then making sure that your loops are set up properly. Using headlights is also really, really helpful. But with loops, you really want to make sure that they're helping you to actually maintain a neutral spine, so that
Yeah.
sometimes if the scopes are, they're not sitting properly in your pupils, you actually have to tilt forward to look through, and that defeats the purpose. So we want to make sure that that's not happening, and having the steepest declination angle possible on those loops is also really helpful for that.
Yeah, because obviously the steeper it is, the more kind of
Yeah,
upright you're going to be.
exactly.
That kind of makes sense. And then if you kind of see somebody, do we normally start doing some exercise and stretches like the ones with the little balls that was on your IGTV? Is that the first step if someone has got some back pain, or are you trying to work out other things first, like try and change things in the office before you start doing those things?
Mm-hmm. Yeah, so my preferred flow of things is correcting ergonomics first. But you can also kind of start working on, so the demos that I have on my IGTV with the therapy balls, those are targeted at working out the muscle knots. So those are definitely something that you can implement early on. It's actually great to do that now while, things are a bit slower, so
Mm,
that, even if it doesn't necessarily feel so painful right now, if you like really feel around there, you could probably still find some knots. So working those out and making sure that you're getting proper circulation and, you know, those muscles are good and healthy, those are all things that you can start with. And then implementing chair side stretches is also another important component of it. But that's, again, that's, you know, that's probably maybe step 3 or 4. And then doing the correct exercises would be probably the very last thing that I would introduce. You don't want to introduce exercises too early on. You want to make sure you're setting a baseline and having a good foundation to work off of before, because sometimes, you know, trying to strengthen muscles that are a little angry, sometimes that's not really the best idea.
Right.
So you want to work through those steps slowly.
So, is this something that, for example, I was fine up until the point where I stopped going to the gym because we had final examinations. I spoke about this last week as well with one of the dentists we had on. I think it was 18 months I decided I didn't go to the gym. And then during that period, you know, you're going to the library more, so you're sitting down more.
Mm-hmm.
What kind of changes happen in that kind of a period where you're sitting down and not doing as much exercise in terms of which muscles are getting weaker? That might need like some attention afterwards, because then afterwards I've gone into work and there is some, you know, lower back pain towards, you know, lower left, right
Yeah.
above the hip bone.
Yeah.
So what muscles have I kind of imbalanced there, if that makes
Mm-hmm.
sense?
So there's a lot going on there. So motion is lotion, which means that once you stop moving, your joints aren't getting the proper nourishment and lubrication that they need.
Mm,
So that was probably phase 1. So, you know, the joints weren't getting that movement that they were used to, and that keeps them healthy. The next thing, yeah, so now you're going from working out to sitting a lot. So, you know, probably the setup at the library wasn't the greatest. You know, if you're um, our bodies don't like to be in one position for very long. So, you know, you want to be ideally taking posture breaks every 20 minutes. I know that's a little bit hard,
yeah.
but you know, the muscles that start to get lazy would be you know, just the whatever, if you're not using it, if you're not using it, you're losing it, right? So
Yeah.
there's a whole variety of things, and then as well as muscles that are tensing up as a response to the stress. So for everyone, that's different. Everyone's body is a little bit different, but most commonly, you know, right up here, the upper traps, that's the number one that we most common one that we see.
Yeah.
So yeah, so there's deconditioning happening at all sorts of levels and all sorts of you know, areas of the body, and that can definitely predispose you to having low back pain when you go back to the operatory, because those muscles aren't used to being, you know,
Actively
to
moving.
supporting you in that way.
Yeah. Guys, have we got any questions for Nadine in the comments? Should we move on to the ones that we got through the stickers?
Yeah,
Um,
sure thing.
so I've got one that we had, and again, it's lower back pain. I think it's the more common one for a lot of guys. So
Mm-hmm.
he's had lower back pain for about 4 years. So where would he start? That'd be the same kind of bits we spoke about already.
Yeah, so look at your chair setup, you know, working through the muscles. So, you know, any sore muscles, you want to make sure that right now, obviously, it's really hard to get a massage. So that's why I started putting
Yeah.
out those videos showing people how to work through those themselves. So you could do foam rolling, or you could use the therapy balls that I showed. And then once, you know, that pain cycle has kind of subsided, then you can work at, you know, doing those bird dog exercises, plank, strengthening the core so you have a nice stability around the spine.
Yeah. What kind of stretch is that, kind of, touching your toes? Is that useful? Things along those lines, or is it more
Uh,
specialized?
yeah, so touching the toes, that, you know, some people that doesn't really agree very well with them. You know, knees to chest might be a little bit better. There's a couple chair side stretches that I show in one of my IGTVs that are really good. You know, you wanna stretch your hamstrings, but you don't want to be straining. You don't want to be injuring yourself. So,
Mm,
this is a good situation where it's better to work with a healthcare professional that can kind of walk you through what they recommend for your specific situation. But
yeah,
yeah.
it's not the easiest. Well, obviously, yeah, we need to be able to go and see someone. So, um, yeah, I think that kind of thing's going to have to maybe wait. So just kind of take it easy for the moment and do little things. And
Yeah.
yeah, What questions did you have on your stickers? Did you get someone across yours?
Yeah, I got a couple. I got one that was along the lines of how to prepare for a long dental surgery. So this
Mm,
person specifically wanted to know, how do you prepare your body for like a 2 hour surgery? Um, so basic same principles as before, but I would add on, you want to make sure that you're um, taking breaks as much as you can. So my recommendation specifically for chair side stretches is every 45 minutes to just, change positions, like just look up, give your body a break. When it comes to hand instruments, some good things to keep in mind is you want to be changing as much as you can the type of the instruments that you're using so that your your hand isn't in the same position all the time. So what I mean by that is switching from something that's a little bit thicker to something that's thinner so that your muscles get a bit of a break.
mm,
Keeping making sure your tools are sharp so that they're efficient and you're not straining too much with your hands. Reducing as much as you can, that vibration through the hand because that can predispose you to a lot of different things. Reducing the amount of time doing the same task. So switching things up whenever you can. So those are all, general things for that. And then making sure that you're in an optimal working position. So making sure that, everything is set up ergonomically so that your spine is in a neutral position.
yeah.
And also, keeping a good regimen at home of, your exercises and making sure you're looking after your spine even outside of the dental office. So being careful of when you're on your phone, are you looking down or, are you keeping a good neutral spine? Is your mattress and pillow supporting your spinal health? Those kind of things.
Yeah. So outside of the surgery, what are those the main bits that people kind of get wrong? Is text neck,
Yeah.
and then what other habits are there that obviously it's going to be difficult for us to absolutely stop doing the work, but there are maybe other
Mhm.
things as well we can kind of modulate um, alongside making the little changes with the chair. So we're sitting at the right angles and having the patient the right height. So what other things are the kind of general ones that we can change?
Mhm. Making sure that you're not that your breathing isn't too shallow. So, especially we find this happens, in times of stress, you're breathing into your chest as opposed to a full diaphragmatic breath. So that's another thing to be more aware of. So practicing, deeper breathing and trying to maintain that as much as possible. That
Yeah.
actually also serves as a protective function for your low back. So having diaphragmatic breathing is great for making sure that your low back is in better shape. So that's one thing. And then outside of the operatory as well, like when it comes to home, make sure you're not stomach sleeping. That can be really not great for your spine. Also, resist the urge to like crack your own back or crack your neck. Those aren't really generally good ideas. You could really hurt yourself.
Right.
Um, yeah,
Is that common, people doing that?
cracking their own back.
Yeah, I'm not even sure where you would start. You have to like
Yeah.
log or something.
I've had patients tell me that they ask their children to walk on their back, or they're just in this habit. And I understand it. Like, you feel some stiffness, and then you crack your back or you crack your neck, and then it feels better. But the problem with doing that is you're not actually taking care of the problem. Usually you're not targeting things in the right direction or the right segment of the spine. So yeah, so that's why, it doesn't actually solve anything. If anything, it just creates other issues for you.
Yeah.
While, it might feel good in the short term, over the long term, it's really not a good idea.
Yeah, because I know that I do some of the football stretches that where you lie on your back and you bring your
Mm,
knee across to one side.
yep.
I tend to get like a click in my back when I do
Yeah.
that sometimes.
Yeah, and if that happens, that's fine. Like if it's,
Mm,
inadvertently you're experiencing, our joints sometimes our joints make noises and that's fine, but my point is not to intentionally do that.
yeah,
So I time kind of twisting themselves in directions to induce that, and that's what I would recommend against. But if it happens during a stretch, whatever, it's okay.
mm, yeah. I see. I know because a couple of weeks back, I don't know why I went quite deep on YouTube, and there's a guy um, he's a chiropractor, and you must have seen him. He's the one who screams every time he does a click, an adjustment,
Yeah.
and he runs off shouting, so it's quite amusing.
So yeah, I would be wary of that. That's
Yeah.
not typical what a real chiropractic experience is like. You have to be mindful that things on YouTube are usually there to generate views and whatever,
Mm.
and it's really not like that. Like my office does not look like that at all.
Yeah.
Chiropractic here is normally very gentle. It's not that
Because
dramatic.
I was wondering whether that was kind of typical because he's kind of they're kind of moving the neck quite not. I don't know if it's forceful or not, or it's like a valid technique when they're turning it to one side, and then you hear
Hmm.
the release down the spine and stuff.
Yeah, I mean that is it is like, something that we do, but within a very like low
Controlled
amplitude,
way.
as
Yeah.
opposed to something really like, the head shouldn't look like it's flying off.
Yeah, because obviously it's probably the same as how non-dentists will look at dentistry. They're going, "What the heck are they doing?" Uh, just don't understand it. It looks a bit crazy
Yeah,
sometimes, but yeah, so
yeah.
I did wonder whether this guy was kind of just playing it up for the cameras or there was something, valid behind it. Um, did you get another question as well? I got a couple of, but they were all saying lower back pain. So
Yeah.
I think that was kind of the common theme. There were two or three saying lower back
Mm.
pain. So um,
There was one other one that I got, and it came from an oral maxillofacial surgery resident. And
mm,
it was just about, what to do for, standing for long hours hunched over in the OR because of a short attending. So obviously, this is a case of poor ergonomics.
yeah,
I guess the surgical table has been adjusted for a shorter person, and so when you're trying to
oh,
assist
much
in that
taller.
surgery,
Okay.
yeah, so this person's taller, and so they're feeling quite sore. So that's a tricky situation. If the attending could get on a step stool, maybe that would make it a little bit better for everybody. But yeah, that's a tough one. So just doing, I guess, whatever you can to kind of reverse that positioning and open your back up again. And then hopefully when you're done your residency, you'll get to have more control over that setup.
Yeah, you'd be the guy in charge, so you can say, well, you will stand on something. Um, I did have a question. So are you familiar with? I suppose it'd be similar to maybe American football, but rugby players
Okay.
with the neck exercise that they do. They have this weird thing that's got like a strap on it, and then they're weighting it up like this. Is that something
Okay.
that's ill-advised or not?
Sorry, help me understand. So they have something around their head. Is it
It's like a
weighted
hat,
or a hat?
and then it's got
Okay.
a strap on it, and then they will tie a weight through that, and then do kind of raises whilst bent over at 90 degrees.
Hmm. Yeah, I'm not too familiar with that. I wouldn't advise that for the general population, probably not for
Mm.
dentists. I'd have to look into that a little bit more. That sounds interesting, but I'm not sure what they're trying to achieve there.
I think it's because within a scrum they go right in
Hmm.
across each other, so they need
Okay.
quite strong neck muscles. But obviously they're
Yeah.
going to take a lot of kind of a
Hmm.
beating there. So I wondered whether there was something you could kind of incorporate in there as well, kind of strengthening the back of the neck as opposed to the
Yeah.
stretching forward.
Yeah. So,
You'd have to be very healthy to start with, I think.
yeah. So, it's not so much about strengthening the back of your neck. Those muscles are actually
Right.
normally quite strong. So you want to, again, the deep neck flexors that you want to focus on strengthening. Um, so what happens is, we have two sets of, two basically categories of muscles. We have our postural muscles, and then we have our mover muscles. So for the practice of dentistry, you want, your postural muscles are the ones that we need to be really strong and active, because those are
Yeah.
the ones that are actually supporting your spine. So what happens in cases where, our body isn't prepared for that, or we're not really well conditioned for that, is our body starts to use those mover muscles to sub in and work as stability muscles, and they're not meant to do that. So that's when you start to form trigger points or muscle knots in those traps, or even in the SCM muscle. Those muscles aren't normally meant to do the stabilizing work.
Yeah.
But they sub in when our deep neck flexors aren't working properly, or those muscles are a bit more lazy.
So yeah, I just want to. I'll try and find a photo. Actually, I'll pop you on this side. Um, let's turn this camera this way. Hopefully, it doesn't fall over because my holder's been playing up a little bit. Let's see, where are we? I think that was most of the questions. I think they were very similar, actually. Most people were
Yeah.
suffering from kind of some sort of lower back pain. I think a lot of us, I think it takes a lot more kind of a problem for us to have an issue with the necks. That's what it seems to be like. The neck maybe takes a bit more of a battering before it kind of flares up and gives us an issue. Is that something that sounds about right?
Absolutely. So our bodies aren't fragile. They can take a whole lot before they start to really it starts to really act up and complain. So this
Mm,
is when I really like to start to talk about prevention. So, in dentistry, you guys have done a phenomenal job of educating the public on the importance of, good dental hygiene as a prevention, as opposed to, waiting until your teeth hurt before you go to the dentist, right?
yeah.
Because obviously once there's pain, that means that there's a bigger, deeper rooted issue that will need a lot more attention to take care of. And so it's the exact same with our muscles and joints. You want to be doing things in a preventative manner, as early as being a dental student. I know a lot of dental students start to experience issues right from dental school.
Yeah.
And so being one step ahead and, not waiting until you're in pain to actually do something about it, you're going to be in far better shape.
Yeah, I think that makes sense because from anecdotal evidence personally, I felt I was very kind of, I didn't have any issues with any of my body parts when I was more active and taking care of myself, doing twice daily gym and stretches one time and workout the second time. So that definitely made a big difference kind of to me. So it makes sense that the same way that we would do things with our patients, stop having sugars, having XYZ, soft drinks and all the other bits and pieces that we're telling them. It makes sense that the same thing is, for the rest of the body. This is the harness I was talking about. Let's just turn this around. Uh, if you've seen something like that.
Okay, okay. Yeah, would not advise that for you guys. It looks like it's trying to strengthen, yeah, like the back of the neck, which that doesn't look
Mm,
quite safe for the general public. I see a question coming
yeah,
on here. Uh,
oh yeah.
do you recommend exercise daily or to do any specific exercise between patients? So between patients, even during a patient appointment, I recommend chair side stretches for sure. Brief brief frequent stretches is more important and more useful to you than infrequent longer periods of stretches. So
Mm,
that's that. And then in terms of strengthening and endurance, obviously you're only exercising once a week, you're not going to see you're not going to see change. You want to be making sure that that's a regular part of your regimen, a couple of times a week, to actually build muscle strength in the right way.
yeah, thanks for the question, Raina. Let's see if we have any others. Uh, yeah, so I think that's most of those ones. What's kind of the maintenance kind of, because a lot of the things that we've been talking about, how to get the back on track in
Mm-hmm.
terms of maintenance after we've got to a point where it's no longer painful. um, is it the same things again and again? Are we looking at monthly massage, weekly massage, or
Yeah.
what's the frequency of these things?
So it depends on everyone. Everyone's going to be a little bit different, and it takes time to figure out your groove and what works well for your body. So, at the very beginning, when you're working with a massage therapist, chiropractor, physical therapist, you're obviously going to be looking at a lot more frequent visits to get your body in a good place. And then once
Yeah.
you're ready for maintenance, that's kind of a one-on-one thing you have to figure out with your clinician or your healthcare practitioner to figure out, what their recommendations are specifically for you. But, with that also comes your daily habits and making sure that everything is, you're providing an optimal
Taken
environment
into
for your
account,
body
yeah.
to be.
Amari, you're laughing at the neck brace there. I think that's what he's laughing at. Yeah, let me have a little think. I had a couple of other questions and they've just gone out of my head now. I was looking for that photograph. I think it's interesting the difference between stood up, working stood up, which are surgical kind of methods where we're maybe taking teeth out, or doing maxillofacial work, which is the issue that the guy who's really tall had. It's maybe why he should be a little bit shorter, average height's better. And then what maybe some of the rest of us are doing. So for myself, I'm working in the chair most of the time unless we've got an extraction in. So it's not a lot of movement, obviously. So there's a big difference between those. So if there's guys who, is it a different kind of regime for each person in those different situations?
Yeah, so when it comes to like general practice, where you're going to be mostly sitting, it's actually probably most ideal. When it comes to, whether if you're short, you also want to make sure you're not, doing this to try to be to do your work. So most of the research and the work that I've done has been focused on that. Next step is to figure out all the different specialties and all the different, unique problems that they face, and specifically oral, like, OMFS surgeons, because obviously that's very different. If you're going to be standing a lot, one thing you want to look at is making sure you have good supportive footwear. So having, custom orthotics, you still want to take breaks. Too much standing isn't good for you either. So those are my 2 cents.
Yeah, I think that kind of makes sense. Guys, have we got any more questions? Oh, Michael's got a question already. Perfect. What exercises can we do at home? So you got a couple on IGTV, and you were also talking about yoga. So what are the things in yoga that are useful?
So with yoga, I mean, there's so many different types of yoga. What what's great about yoga is that it's focused on proper alignment and posture and, kind of.
That look all right.
Yeah, I mean, yeah, so basically like almost just like undoing all of the positions that you're normally in and just going into the reverse of that. When you're working through the stretches and exercises, you do want to make sure you're focusing more on the side that is less or that's tighter. So for example, if you're finding that bending to one side or the other is a little bit more restricted, then you do want to focus a bit more attention there, maybe spend more time there. And then, so to answer the question with the exercises, I had named off a couple that would be really good to start off with: bird, dog, plank, side plank if you're really ambitious, the chin tuck, and then the lower trapezius one, so the prone Y. But if they want to check my IGTV, I do demonstrate a couple of those really quickly. But yeah, I mean, just find the yoga class or instructor that you love and stick with it. That's probably the most important thing. You do want to be careful about certain things that you shouldn't do. So, back bends that seem, uncomfortable, you do kind of want to, you don't want to really jump into that right away. You want to avoid, there's a yoga pose, a locust pose, which, probably isn't, it's kind of similar to the Superman. So this is the one when you're on your belly and you're raising both arms and legs up off the floor. That's one that, sometimes appears in yoga and other various exercise programs. You want to stay away from those as well. Just because it puts a lot of, compressive forces through the spine and can really put you at risk of injury. So
is that something that's more kind of directed at people who are already quite fit, if it should be done, or is it something that you just completely kind of?
I mean, it's I just generally don't recommend it. I just don't feel like it's worth the risk. Some people do it and get away with it, and that's fine. And then you want to also make sure that you're not over strengthening the muscles that are angry. So for example, push-ups, you don't really have to have that in your regimen just because you already have a lot of trigger points in that area. So you don't want to really over strengthen your pecs. You know, if you don't have issues there, then you could probably get away with it, but that's one of the general ones that I don't advise. Anything for the upper traps, so like a vertical row where you're like lifting this way, that's going to focus on right up here, not necessary. Um, yeah, those would be the couple that I usually talk about.
Yeah. What are your thoughts on kind of more gym work? So assuming everything is now back open,
Mhm.
and we're allowed to, go to the gym and do kind of weights and things. I
Mhm.
would normally be doing some sort of powerlifting
Okay.
or kind of bodybuilding, so something in between the two.
Yeah.
Is that something that's advised or not advised, or is it again kind of dependent?
Yeah, so again, you want to make sure that with certain muscle groups, you want to be a bit more careful around. So, you know, if you're doing anything that's, you know, really going to uh, work up here or the, you know, the deltoid muscle, like the anterior deltoid, you want to be careful. Um, a horizontal row is actually would be great to do at the gym. So this is one where you're doing this and you're squeezing the back of your shoulder blades together. So
Yeah.
that one's really great again for enhancing posture. I mean, specifically with powerlifting, you know, if you're asking me if that's going to improve your you know, your career in dentistry, you're not powerlifting and you're not doing heavy work in dentistry, right? You're doing
No. Yeah.
long sustained actions as opposed to doing really forceful sudden movements. So I mean, if you find it beneficial or if you know if that works for you, that's one thing. But you know, for general recommendations, that's my
Not for maybe back pain, but if you want to do it, then just don't be silly with it.
yeah, exactly. Be careful.
That
Make
kind
sure you
of thing?
stretch
Yeah.
stretch afterwards. So you want to
Not
be doing a
before. Yeah.
dynamic warm up before. Make sure you're getting the blood flowing to your muscles, and then a good stretch afterwards as well to make sure your muscles are healing properly.
Mm. Where do you stand on foam rolling?
Foam rolling is great. So it's the same idea as the couple tutorials that I put with the therapy balls. So the idea is, you know, you're trying to um, bring better circulation to muscles and kind of stimulate healing in those muscle knots.
Mm.
So everyone's, you know, body type is different. So me being a smaller frame, I don't love foam rolling for myself. I find it to be a little bit more difficult, which is why I tend to, you know, go towards the therapy balls as something that's I feel a little bit more versatile and more comfortable.
Yeah.
But yeah, no, foam rolling is great. If you love foam rolling, then go at it. Um, but yeah, make sure you know you're targeting all the right areas. So you know, you want to make sure you're getting your pecs, your suboccipitals, your traps, hip flexors, your low back. You know, if you're experiencing any form of sciatica, like shooting pain down the leg, you know, perhaps you need to work through the piriformis muscles. Those are the glutes. So yeah.
Is there any way to stop the IT band from hurting when you do that?
Okay, so the IT band is a little controversial whether or not you should foam roll it. So the IT
Yeah.
band is a band. It's supposed to be tight. So I don't really love foam rolling the IT band. You know, getting there is a muscle that's like at the side of the hip, which, you know, you can kind of play around with. Getting the glutes is important. Getting the lateral aspect of the quads is great, and the hamstrings. But the IT band is excruciatingly painful to foam roll, and I think it's for a reason. I don't really know if we're supposed to.
Yeah. I don't know. I think that was just one of the things when we started doing it. There's one guy who this is a good while back when we were in university. He's like, "Oh yeah, you just move your body this way, see how that feels," and everyone's just on the floor. It hurts, you know.
Yeah,
I was like, "I'm not doing
yeah.
that again."
Yeah, no,
um,
much more effective or like, you know, therapeutic would be to get the quads, especially the part of the quads that's closer to the IT band, but not
yeah.
directly on.
Um, no, I think we've gone. I can't think of anything we haven't covered there in terms of back pains and dentistry, how we can change our chairs, a bit more foot support maybe. So we're kind of having more of our weight through our feet as opposed to the hip hinge and down the chair.
Hmm. Hmm.
That's something that I think we spoke about as well. I can't think that we've missed anything. if anyone has any
Yeah, I think we
questions,
were pretty comprehensive.
anyone has any questions, then obviously you can shoot them across to either of us, and likelihood is I won't
Yeah.
know anything, so I'll just ask you.
Yeah,
um,
no, anyone can send me a DM at any time. I'm happy to help. I'm probably going to be doing a couple of things more. So the initial video that I put out, that was kind of just like a feeler to see whether there'd be interest in that. And so I went over some things in general. So, you know, when it came to chairside stretching and exercises and all that stuff. So
yeah,
I'll probably end up doing some more thorough videos just to explain those concepts a little bit more and to like give people an actual maybe exercise routine or something. So yeah, if you have any content ideas that you want to see, I'm definitely happy to help with that anytime.
yeah, no, for sure. I think that would be interesting. Guys who are still watching, any questions around back pain, any specific issues that you've got, we'll try and cover those. And we've got about 10 minutes left of the live stream before it kicks us off. So we can try and go through a couple more questions. What made you decide to actually become a chiropractor as opposed to anything else? Did you have some other things in mind, or what was that journey
Yes. So for the longest time, I told myself I was going to become a dentist.
like?
Um, so initially, that's what I don't know, like I always had a great relationship with my dentist.
Mm,
Maybe it's because I got so much praise when I went in to see my dentist for my excellent oral hygiene. But yeah, that was kind of the trajectory I was going on. And then I don't know, one thing led to another. I discovered chiropractic, and I just really loved how it fit with my philosophy around healthcare. So, you know, I was always very much of the you know, more of the preventative approach, looking at things kind of more broadly and
mm,
addressing the root of issues. I loved that I would get to work with my hands, but also be active. And so, and you get to help a lot of people and spread, you know, and really help people live their best quality of life, which is
yeah,
something that, you know, it's very important to me. I think to help people get the most out of life and the most out of their careers. Some people just live in pain all the time and they don't know that there's something that they can do about it. And it just makes my day when I can, you know, help them see the light.
yeah. I think that's pretty cool. I also feel like chiropractic might be slightly more not risk free, stress free than dentistry sometimes. Um,
Yeah, it's a, yeah, we're not cutting into people, so.
yeah, no, there's no slips with knives and things, so I'm sure you're doing nicely there. Um, let's have a look. So, did we get another question? Not just yet. So, there's something we've been doing with the guests at the moment. I don't know if you've been watching this week. So, since last Thursday, somebody asked us to put our most used emojis. So, we're doing top fives. Mine haven't changed since yesterday, guys. Sorry. um,
So I have to put in my top five emojis.
the top five. This is the people on the live only. Everyone who watches it back won't be able to see it.
Okay, cool. All right.
Is there a back pain emoji?
No, there isn't, but there's a good injured one here. I
Um,
guess those are the ones I use most often.
no, fair enough. Crying. Oh, so is it true?
Is it true? There's
Over it.
get thumb pain. Um, well, sometimes dentists get thumb pain as well.
Yeah.
So chiros get back pain too. Um, but I'm not usually using, so I mean, not all of my adjustments involve using my thumb. So, you know, usually sometimes it's this part of my hand,
I know, but
or, oh no, I don't. But yeah, I mean, sometimes it really depends. So a lot of chiropractic, like, you know, the training that we get in chiropractic school is how to protect our own bodies.
mm,
So learning how to use our biomechanics and how to have, you know, good stability. So for sure, like, you know, if you have hypermobile thumbs, then you can definitely injure your thumb there. But for the most part, I try to be careful. I do my exercises, take good care of myself, and that usually takes care of it. A good
yeah.
question.
What? So I think dentists always have a funny story from the clinics or something. Do you have something similar where there's like a crazy story with a patient, obviously without
Oh.
uh, divulging any information about who they are, etc., etc. Do you guys have that kind of thing as well?
I mean, the area that I work in is pretty like, you know, everyone's pretty ordinary. I don't know. Like, I mean, there's, I don't know. I can't really think of anything off the top of my head. I've been in practice for 2 years, and the last 2.5 months I haven't
Mm.
been in the clinic for obvious reasons. Um, so I don't know. Nothing really comes to the top of my head, but if something comes up, I'll make sure I'll share it. I just saw a question in here.
Yeah.
I'm wondering, are there standing desks or adjustable height desks are better than normal desks for a student? That's a great question. So this is a dental student, I think.
Yeah.
Um, Standing desks are great if you know how to use them properly. So when it comes to desk ergonomics, you want to make sure that you're changing positions often. So if you have one of those desks that, yeah, or adjustable height, you can go from sit to stand. That's great.
Yeah.
You want to make sure that your chair is supporting you properly. So your desk chair should be, adjustable and allowing you to sit in different positions. You also want to make sure, you didn't ask about this, but if you're studying from a textbook, having like a cookbook holder is a really great idea from keeping your neck from doing
Oh,
this
is that
while you're
to, like,
studying.
tilt it? Oh,
Yeah, exactly. So it just kind of brings it up to eye level, which is great. And then, yeah, if you're watching things on your laptop and if your laptop is, just a little bit lower, you bring things up to eye level is always a great idea. So yes, great standing desks are fantastic if you're able to make that investment. Especially, in dental school, you're spending a lot of time studying. So take good care of your back while you're doing that too.
mm. Yeah, I think that makes sense. Let's see. Nothing on the tab. A few bot comments, I think. So we don't need those. Yeah, I think it's been really useful, guys. So if we've got any couple last questions, then drop them in there. Let's have a look. Let me just get my notes back up, see if I have anything left. No, I think we went through pretty much everything. Where do you kind of see chiropractic?
Sorry, yeah, now
I
you're
opened
back.
my
Where do I see?
I opened my AirPods case and it paused everything.
Ah, okay.
Yeah, where I didn't know I was going to do that. Um, where where do you see chiropractic kind of going? Is there something where like you're going to how do you see your career kind of going within chiropractic? Is that something you've thought about much?
My career myself.
Mm,
Uh, so for myself, I obviously want to have a very strong clinical practice first. So that's something that's continuing to grow and evolve. So just take time. And then from there, once I kind of establish myself in that sense, my hope and my aspiration is to continue to give back to the community in whatever way that I can. So I'm really passionate about advocacy. So not a lot of people know about chiropractic and what chiropractors do. So I really see myself in helping with, kind of elevating the status of the profession and helping more people understand and, getting more
more
people
aware.
to see chiropractors than they need to. So yeah, that's kind of like the broad scope of things. I don't know what that's going to look like yet, but
Mm.
maintaining an active role with my professional associations is, I know, going to be a very big part of that.
Yeah. Do you see kind of is there sort of within dentistry, for example, we have different subspecialties. Is that something that exists within chiropractors as well, or is it everything's very general? How does that work?
So it depends where you are in the world. So in
Mm.
Canada, just like a dentist, once you finish your schooling and you're licensed, you can go out into general practice. We do have optional residency programs that people can go into. So we have five that are recognized here in Canada. So there's orthopedics, clinical sciences, sports sciences, radiology, and I'm trying to remember what the fifth one is. It escapes me right now. But so that's specifically in Canada. In the US, there's tons more.
Yeah.
And then some people just take a special interest in certain topics. So, some of my colleagues have gone into prenatal care, so they really focus on helping pregnant women. Some go into pediatrics. That's also a very popular area to go into. So, and people will take more like continuing education classes on those topics and really become experts and niched in that area. So that's how it works here. So
Yeah. Nicole's put a comment down there. I think she needs to survive with the cookbook holders. Yeah,
Yeah.
thanks for the question, Nicole. I think that's been really useful. Something that I didn't even think about, kind of study height of the desks and things like
Mhm.
that. So it's always these little small things that you can change that you maybe wouldn't think about, and then lots of small changes obviously lead to a bigger change overall, and usually the sum of small changes is bigger than each one individually. Is that kind of how it goes?
Yeah, absolutely. I think starting small and adding on bit by bit is the best way to do that.
Yeah.
You want to be building good habits, and so that takes time. And you don't want to be throwing a whole bunch of new stuff at your body at once. And it's also going to take a little bit of trial and error. So, to find the right stool for you, it's going to take, and that's okay. Like it takes some time to figure out what agrees with your body. Like we can give general recommendations, but the fact is everybody's body is different, and you're gonna respond to certain things differently. So,
Yeah.
um, but yeah, but like don't be afraid to make the investment in these things. So the way I see it is either you're gonna spend your money on having good equipment, or you're gonna spend your money on getting your pain sorted out.
Yeah. Do you see many people who've coming in with, obviously some dentists have no loops, some have loops, and some have more microscopes. Do you see a big difference between kind of the three?
It depends. It depends on how that's affecting their posture. So
Mhm.
my personal preference is like loops that are vertically adjustable. So the through the lens loops, while they can be customized, sometimes it doesn't allow you to have as as
A
steep of
steeper
a
angle. Yeah.
yeah. So it really depends. As long as the loops are providing good safe neck working posture, then that's great. Working without loops, like I've been reading so much research about how the loops really make a big difference.
Mm.
So yeah, so I definitely would go down that route. I saw another question come in.
Spine
Thoughts
X-rays,
on spine x-rays, review spine x-rays.
spine position improvements.
Yeah, so every chiropractor is a little bit different when it comes to x-rays. And it's really just a judgment call whether, it's warranted for the patient. Um, so I think this person's looking at, yeah, I mean, it depends what the intent is. Like we definitely do see how posture can affect the, positioning of the spine, and, what kind of degenerative things can happen in the
Yeah.
spine because of that. So, it really depends on a lot of different factors. There's so much diversity in the profession, and so X-rays can be really helpful and sometimes not, but yeah.
Yeah, we just had the 2 minute warning, so
Okay, no
normally
problem.
it cuts us off. So I try not to kind of
Okay.
butt in, so I just type it in sometimes. Yeah, thanks for your question, Smile. I think he's asking, like, do you, like the same way we would take an X-ray to check for decay? Would you take an
Hmm.
X-ray to check for the spine position? Is that something that they do?
Uh, Yeah, yeah. Some chiropractors do that.
Mm.
So yeah, that can be helpful. And then as well, if there's any suspicion of some sort of instability or something that would maybe need further investigation, it can also provide clearance for that. So
Yeah, cool. I think that's interesting. Um, I think we'll probably call it there, because I think if we do any more questions, we'll end up kind of getting cut off by the time limit. So thanks for coming on. If you guys aren't already following Dr. Nadine, then make sure you kind of jump across to her profile, check out the videos which are showing us how to kind of do a couple of bits and pieces at home. And there's going to be more coming, it sounds like, so that's going to be really interesting. So yeah, thanks for coming on. And make
thanks
sure
for
you guys,
having me. This was fun.
yeah, I think it's nice to kind of see different things, and sometimes move away from just dentistry and like case studies like we did yesterday with Karina, and do something a bit different sometimes as well. Um, yeah, guys, make sure you're following Nadine, like we said before. We've got loads more coming on, so after you followed her, turn on live